In paper 2, we are having all the formulations, yogas. Okay. So today I am dealing with this paper 1. So paper 1, again, theory carries 100 marks. So in this, when we go through the question paper, again, this is a new pattern question paper. In this, the MCQ questions are the total 20 marks. Each question carries 1 mark. That is multiple choice questions. And short answer questions, 8. Again, each carries 5 marks. That is 40 marks. And long answers, total 4 questions. And each question carries 10 marks. That is 40 marks. Total 100 marks. And similar paper 2 also. In paper 1, that is Ayurveda Aushadhi Nirmana Vijnana, we are having total 14 syllabus points, starting with the chronological development of Ayurveda, Aushadhiya Nirmana. In this, we are having the basic uh, chronological development of Ayurveda, like pre-Vedic, Vedic, and post-Vedic, and recent period. Later, second point is Paribhasha, Adharabhuta Siddhanta, Yantra 1 and Yantra 2. Later, we are having Bhaishajya Kalpana concept like Kalpana Nirmana 1, Kalpana Nirmana 2, next Rasadravya 1, Rasadravya 2, Rasadravya 3. At 11, point number 11, Kalpana Nirmana, again here Vaishyaja Kalpana concept, Chaturvida Rasayana. Here, hello. Question number, syllabus point number 12 is Chaturvida Rasayana, that is Pattali, Parpati, Kupi, and Kalvi Rasayana. And two more points, recent points like current and emerging trends in Ayurvedic pharmaceuticals. And last one is the 14th point is the D and C Act. Okay. So long questions. There are total 4 long questions are there. So each carries 10 marks and there will be no choice questions. All are must answers are here. We will get question syllabus point number 6. We will get one question for long essay. Syllabus point number 7 we will get 1, and syllabus point number 8 we will get 1, and syllabus point number 11 we will get 1 long essays. Okay, in this similar way, the short essays and MCQs. Okay, so coming to the syllabus point number 1, syllabus point number 1 carries total 5 marks. So the question will be one short essay, okay, or one short answer. Okay, the syllabus points like chronological development of Ayurveda Aushadhi Nirmana. So in this point, we are having a definition, chronological development, significance, scope of Rasashastra, Vaishajya Kalpana, concept of Rasashala, Rasamantapa, and Vaishajagara concept, Rasa Rasayana concept. Okay. So and recent development in Ayurvedic pharmaceuticals. Okay. Coming to the some of the for the lecturer purpose, they are given like must know, desire to know, and nice to know. So everyone know already were aware regarding this must know, desire to know, and nice to know. Already were written in first year exam. In that 10 marks is given for nice to know and desire to know, and remaining 90 marks will be asked, or the questions will be from must know. From must know 90 marks and 10 marks for desire to know and nice to know. So in syllabus point number 1, the must know topics are like historical evolution of Ayurveda Aushadha Nirmana, and contribution of Nagarjuna to the field of Rasashastra, and describe the structure of pharmacy and enlist the formulations. These are the must know, and remaining are the desire to know. Okay. Coming to the chronological development of Ayurveda. So Rasashastra, Ayurveda Rasashastra. So introduction in relation with that chronological development of Rasashastra. So about 300 years ago, the Indian alchemy, that is Rasa Vijnana. So in we are having the historical evidence of metallic art like from Harappa and Mohenjo-daro. civilizations. In the similarly, we find evidence of using metals and minerals in our Samhita. Chronological development of Rasashastra. The development of Rasashastra is an independent branch started during 8th century onwards or 10th century onwards, and golden era or golden period of this Rasashastra is said to be 4th to BC2 and 14th AD. Okay, so in this period it was blended with the mainstream medicine due to a decline of surgical practice or surgical procedure practice. So to understand history of development of Rasashastra, we can classify or we can divide the time period to Vedic Kala, Samhita Kala, and Sangraha Kala and Adhunika Kala. So in Vedic Kala, like in Atharva Veda, we will get many references like Rasa Shastra Dravyas, Swarna, Rajata, Tamra. In the similar way, the Atharva Veda gives different names of Anjana and its uses. Swarna Prashana for Sadyojata as a Balavardaka and prevent occurrence of diseases in a growing period. Okay, and in Yajurveda, again, we will get Swaranadi Dhatu explanations. In Rig Veda, there is a Dapana Vidhi. With, for Dapana Vidhi, they will use these metals. Okay, even in Agni Purana, we'll get explanation regarding the metals, minerals, and basmas. Garuda Purana, we'll get Utpatti of Ratna's explanation. Coming to the Samhita Kala, in Samhita Kala, Charaka Samhita. So in the first chapter itself, Charaka Sutra stuff, you will get the classification of dravyas at Audbija, dravyas, Jangama dravyas, and Parthiva dravyas. Okay, in that we will get these mineral and metals explanation. Okay, and several minerals like Manashila, Aratala, Tutta, these are prescribed by the Charaka Acharya for the Twak Vikaras or skin disorders. In a Charaka Chikista, 16th chapter, we will get one yoga that is Navayasa Loha, Navayasa Churna. In that, Rajasa word is used for the Loha Basmar, Loha Churna. The powder of Loha is said to be an Rajasaha. Again, in the similar way, we will get many such references in relation with Charaka Samhita, like concept. We will get Shilajatu and the Shilajatu types. Okay, in the similar way, knowledge regarding the toxicity of metals. Okay, so coming to the Sushruta, again, Sushruta will get references like concept of Ayaskruti, preparation of Kshara as a para surgical procedure, and different metals like Swarna, Loha, Pittala, Rajata, Tamrata, etc. And Anjana for Netra Vikaras as a Raktastambhaka. In the similar way, Maha Varjaka Taila. Here we will get uses of Gandhaka as a Varna Chikista. Okay, similar way we will get such reference in Astanga, Sangraha Kala, and later in Kautilya Shastra and Nagarjuna will get Adhunika Kala. And recent like Adhunika Kala, like Rasa Komadi, Rasa Kamadenu, other metals, both Loha and Devada, will get such explanations. Okay, in 16th century, Vav Prakasha, and 17th century, Ayurveda Prakasha, and 19th century, Vaishajya Manimala, 20th century, Rasa Tarangini, provide a description of use of mineral and metallic preparation in the treatment of diseases. Okay, so this is a short or brief regarding a chronological development of Rasashastra. Okay, if you usually this may be asked, this question may ask for 5 marks, the chronological development of Rasashastra. Okay, so next one more topic is there. This can be asked for 5 marks. That is the contribution of Nagarjuna in the development of Rasashastra. So we know that the word Nagarjuna is familiar in both Ayurveda as well as Rasashastra. In the history of Rasashastra, since 100th century BC to 9th century AD, we come across many Nagarjunas. According to the some belief, we have he was the friend of like Raja Shalvahana, Shushruta, Prati Samskara, like different names we will get Nagarjuna. But here the Nagarjuna contribution related to Siddha Nagarjuna. Nagarjuna was well versed in Rasavidya, Rasayana Vidya, Mayura Vidya, Vajrayana, okay, and Shunyavada. Even he is said to be that he has lived more than 6,000 years, etc. Okay, and he wrote more than 58 books on Buddha Tantra and Rasa Tantra. Okay, so he was one among the 84 Siddhas in Rasashastra. Okay, Rasashastra, the contribution of Nagarjuna's work. Okay, he written books like Kubjuka Tantra, Loa Shastra, Rasaratnakara, Kakshaputa Tantra, Rudramala Tantra, Arogya Manjari, Yoga Sara, Rasendra Mangala, etc. So some important book like Kubjika Tantra. This text is seen in Library of Nepal, probably written in 600 AD. It was written in Pandulipi. Okay, in one context, Lord Shiva says Parada Marana with 6 part of Gandhaka leads to the Guna Vruddhi. Okay, in the same way, the Rasendra Mangala, the Nagaraju Rasendra Mangala was originally written in Sanskrit. The copies of the manuscript available in Telugu, Malayalam, Devagiri, and other script. Okay, this book contain total 8 chapters. Okay, so and some of the important formulations are yogas, which is attributed to Nagarjuna, like Nagarjunavati, Nagarjuna Yoga, Vishweshwara Rasa, Abrawatika, Rasa-abravati, Nagarjuna-abra, etc. Okay, so next will come the concept of Rasashala and concept of Rasa and Rasayan. Again, coming to the questions in the syllabus point, it is syllabus point number 1 is for 5 marks. They may ask the concept of Rasashala or concept of Rasa Rasayana or contribution of Nagarjuna to the field of Rasashastra or the chronological development of Rasashastra. Okay, so this is a short in relation with syllabus point number 1. Coming to the syllabus point number 2, that is it carries total 10 marks. They may ask one uh, SAQ, that is short answer, and 5 MCQ. Okay, so this is a very important topic for MCQ. We will get total 5 MCQ in this topic. Moving to the syllabus points, this topic is Paribhasha. That syllabus point 2 is named as Paribhasha, that is terminology. So in this we are having definition and importance of Paribhasha, like word derivations like Aushada, Bhaishajya, Kalpana, Kashaya, Panchavida Kashayoni, Samskara. Okay, and later we are having Dravya Varga Paribhashas, like classification of Rasa Dravyas. Rasa, Maharasa, Uparatna, Sudhavargiya, Sikatavargiya, Lavana, Visha, Upavisha, Kajjali, Mitra Panchaka, Dravakagana, etc. And some controversial drugs, they are like we are having Vaikranta, Chapala, Rasanjanam, Pushpanjana, Vanhijara, Girishindura, etc. So these are some points. Coming to the must know and the desire to know, these are again like in this syllabus point, we are having like concept of Amrutikarana, Lohitikarana, Sattwapatana, Sudhavarta, Bijavarta, and Dhruti. That is CDE. Prakriya Paribhashana, CDE, desire to know. So coming to the Paribhasha Prakarana, like in MCQ, there is a chances of asking this classification, Rasadravya's classifications. Like example, Abraka will come under which group, whether it comes Maharasa, Uparasa, Sadharana Rasa. In the similar way, Kampilaka is grouped in Maharasa, Uparasa, Sadharana Rasa, and there may be chances of asking chemical composition of those drugs. Okay, so moving to the Paribhasha, as a Parita Bhashit Yes, a paribhasha. The statement of exact meaning of a word or a verse is known as paribhasha. Okay. So, aniyame niyamakari paribhasha. A transformation of aniyamita avastha into niyamita avastha is called paribhasha. It can be further taken as a form of niyama only. So, we can identify any vastu, then this is called paribhasha. So when you go through the paribhasha definition or lakshana, So avyakta anukta leshukta sandigdhartha prakashitah paribhasha prakatyate deepibhuta sunichita. So here paribhasha gives the clarification of hidden, untold, half-told, and doubtful terms is called paribhasha. Avyakta means which is not properly told or aspashta form. Anukta, whose artha has not been told. Leshukta, those which are told in alpamatra. And sandigdhartha, sandeha in artha or auchitya. Okay, in these conditions, one can use the paribhasha to get the spashta vakya, exact meaning of those things. Okay, so such example, they give some of the basic paribhashas like aushadaha, the osho nama rasaha, so asham diyate yat tat aushadihi, osada arogyam dayate tasmat aushadibha. So in the similar way, we will get the paribhashas of Beshajaha, Kalpanaha, Beshaja Kalpanaha, and Kashayaha, Panchakashaya Yonihi, and Samskara. So Maharasa. Coming to this classification, here there is a maximum chances of framing the MCQs. Like Vaikranta will come under which group? The English name of Vaikranta is, they may give the options like mica, tourmaline, chalcopyrite. Okay, and they may ask that FeS2, Fe2SO3 is a chemical formula of Abraka Vaikranta Makshika. Like that, they may frame the questions. So here the student should concentrate the classification of Maharasa with the name, English name, chemical formula. It may be Maharasa or Uparasa. Again, you have to go through the which will like Gandhaka example. The English name of Gandhaka is sulfur, chemical name is sulfur, and chemical formula. Yes, in the similar way, Uparasa you should go through, and in similar way, Sadhana Rasa, that is Kampilaka Gauri Pasha Navasadhana. In the similar way, you have to go through the dhatus. That is in this dhatus, Shuddha dhatus, Mishra lohas, Puti lohas. We should know Shuddha lohas are Swarna, Rajata, Tamra loha, Mishra loha, Naga, Vanga, and Puti loha. Mishra lohas are Pittala, Kamshavartra, and Puti lohas are Naga and Vanga. Okay. In the similar way, Upadhatu. So in that we'll get Swarna, Rajata, Tamra, Tikshna, Loha, Naga, Vanga, and Pittala. So Uparatta Varga, these are the some classification, Sudha Vargiya, Sikata Vargiya Dravyas, and Visha Varga, Upavisha Varga. Okay, so here the chances of getting MCQs, okay, especially with Dravya classifications or Rasa Varga classification, Lavana Varga. Okay, next is moving to the Prakriya Paribhasha. In this, we are having concept of Shodhana, concept of Marana, Amrutikarana, Lohitikarana, Sattva Sudhavarta, Suddhavarta and Bijavarta, Dhriti, concept of Dhriti again, definition and Dhriti Lakshanas. And seventh point, that is a Parada Samskara, definition, importance, and Asta Samskara of Parada. So usually here we will get chances like getting a short essay or short answer. Here in this syllabus point carries 10 marks, 5 MCQs are there, one question for the short answer. Okay, so they may ask the concept of Shodhana or define Shodhana and explain different techniques used for the Shodhana. That time you have to define the Shodhana and you have to write the different techniques or different types of Shodhana. It may be Shvedana, Mardana, Dalana, Nirvapa, Nirjalikarana, Nimajjana, etc. In the similar way, the concept of Marana they may ask for 5 marks. Okay, that time again you have to write the definition, importance of Marana and types of Marana, that is Agnipaka, Putapaka, Kupipaka, and Bhanupaka. In brief, you have to explain. Again, these Amrutikarana, Lohitikarana, Sattopatana, Sudhavarta, and Bijavarta, Dhruti, these C, D, E, these are desired to know. And again, there may be chances of one question of desired to know. They may ask for 5 marks. They may be concept of Amrutikarana and Lohitikarana for 5 marks, or Sattopatana concept for 5 marks, or concept of Dhuti for 5 marks. Okay, so in relation with Samskara, Astavida Parada Samskara, you have to define the Samskara. Samskaro hi nama gunanta danam uchyate, you have to write that one. And importance of Astavida Samskara and names of those 8 Samskaras. They may ask the question like define Samskara, enumerate 8 names of enumerate the Samskara and explain the Svedana Samskara. Or define Samskara and name the Ashta Samskaras and explain Mardana Samskara. Okay, that time you have to explain individual samskara in detail. This is an Ashta Samskara in a single chart I have explaining. The here this chart, if you know means you will understand these 8 samskara very easily. Okay, so the first is the serial number 1 to 8 samskaras. Second is samskara name, that is Svedana, Mardana, Murchana, Uttapana, Patana, Rodana, Niyamana, and Deepana, etc. In the similar way, the prakriya or the procedure, which type of procedure is followed. And Svedana Samskara, the Svedana procedure, Mardana is Mardana procedure in the similar way till the Deepana Samskara. And Yantra used in each Samskaras. Okay, like Svedana Samskara, we are going to use the Dola Yantra. Mardana Samskara, we are going to use Tapta Kalva Yantra. While in the Murchana Samskara, we are going to use normal Kalva Yantra. While Mardana, we are going to use Tapta Kalva Yantra. And Dravyas, which are the drugs are used for each Samskara. And what is the benefit or pala of that individual Samskara. By doing Svedana Samskara, Parada become Mala Shaitilya Karha. By doing the Mardana Samskara, Parada become Bahirmala Vinashanaha. Similar way, by doing the Murchana Samskara, Parada become Nasta Pishtaka Kara. Okay, so you have to uh, uh, practice this chart better to write this one. Okay, whenever if it is asked for 5 marks, if you return, it will be good. Okay, so next point in this Paribhasha Prakarana only, we are having this Pramani Karana Paribhasha. In that Graya, Agrayata, Siddhi Lakshana. So Graya in general meaning, which is acceptable or which can be taken. Agraya, which is not Marasa, Uparasa, Sadhanasa, all Dravyas, they have explained Graya Lakshanas. Okay, so in the similar way for the procedures, any procedures, it may be you're preparing Swarasa, or it may be you're preparing Taila, or it may be preparing Avaleha, or you're preparing Kubipakwa, or you're preparing Pattali, Parpati. There is a specific Siddhi Lakshanas they have been explained. Okay, so Siddhi Lakshanas will indicate the Paka are properly prepared or the formulation or yoga is properly prepared. Okay, coming to the next point, that is Bhashma Parikshas. Again, there is a chances of asking short essay regarding the Bhasma Pariksha. Okay, the concept of Bhasma Pariksha, or they may ask describe the Bhasma Parikshas for 5 marks. Okay, here we are having the Svari Tara, Reka, Purnata, Unnama. Okay, Slakshnatva. These are the given Bhasma Parikshas. Okay, so we will just glance some important Bhasma Parikshas. So coming to the Uttama Bhasma Pariksha, this Tashopari Gurudravyam Dhanam Chopane Dhruvam Amsavattirate Varinam Uttamam Parikirtimam. This is Rasa Ratna Samuchya reference 8 bar 29. So Bhasma is placed slowly upon the water, and if Bhasma is float and it doesn't sink, so it indicates that Bhasma passes this Unnama. Okay, so before that we are having the similar one, that is Varitara. Okay, so here Varitara means you just we will put the Bhasma, it will float, that is the Varitara. If you keep that dane over this floating Bhasma, that become Unnama Uttama Bhasma Pariksha. Okay. Similarly, Sakshatva is there, and Varna are there, different colors. Like individual drug have a individual color. Like Swarna Bhasma will have Champaka Varna, Tamra Bhasma will have Krishna Varna. Similar way, Rajata Bhasma will have Krishna Varna, Kamsha Bhasma will have Dushara Varna, Naga will have Paravata Varna and Vanga will have Subra Varna. Loha will have Jambu Phala Varna and Abraka is having Istika Varna. Okay. So Avami is especially told for the Tamra Basma and Swarnamakshika Basma. When Basma is placed on the tip of the tongue in a minimal dose or a very little quantity, then it should not produce any nausing sensation or vomiting sensation. That indicates if it is not a process or if not uh, produce any vomiting sensation, that indicate it passed the Avami Pariksha. Okay, so this indicates the significance acceptability of Basma into the system. Okay, in the similar way, Apunagava Pariksha, Guda Gunja सुखस्पर्श मधु आजो संयोजितम नायति प्रकृति ज्ञान अपुनर्भम उच्यते. Here dhatu basma is mixed with this mitra panchakas, that is guda gunja sukha sparsha, that is gulu madhu, ajah ghee, and this is heat is given, there should not be any reoccurrence of the metallic form. Okay, so this is the diagrammatic presentation of this apunarbhava pariksha. So in the similar way, Nirutta Pariksha is there. Raupena sa sayuktam dhatvam, Raupena nanage. Tada Nirutyam Ityuhu Loham Tad Anupanavam. Here we will take Basma, here the example of Rajana Basma here. You have to take the Basma, we will mix with silver and we will heat. When the silver melts, okay, and it is allowed, taken out from the Agni and allowed for the cool. Okay, after that, the silver is taken out and it is weighed. Before and after, there should not be any weight gain in the silver. That indicates if it is there is no weight gain, that indicates the basma has passed the Nirutta Pariksha. Okay. In the similar way, the different basma parikshas have been explained. Okay. So there is a chances of asking this basma pariksha for 5 minutes. Okay. Here this Basma Parikshas. That time you have to explain Varyantara, Rekha Purnata, again, Unnamas, Lakshana, these Basma Parikshas you have to brief for 5 marks. Okay. So next is the concept of Mana Paribhasha is there. Desire to know concept. There may be chance of asking short essay for 5 marks. Okay. So this completes the syllabus point number 2. Coming to the syllabus point number 3. So syllabus point number 3 carries 5 marks. Okay. So in this, they may ask one MCQ and one SK. Okay. Short answer. Okay. So coming to the syllabus points, here in this we are having Adharabhuta Siddhanta, the fundamental principles, Dravya Sangraha and Samrakshan. Okay. So here, getting questions like you may get the 5 marks short answer, Dravya Sangrahan Samrakshan. Okay, so you may get this one, or some concepts like Aushadhi Shavana Kala or Savirata Avadhi. They may ask combine like Aushadhi Shavana Kala and Savirata Avadhi. Describe the Aushadhi Shavana Kala and Savirata Avadhi, or Aushadha Matra, or concept of Anupana or Sahapana. Okay, so here what are the most known things? Almost all concepts are must know except the Saviratavadi. Saviratavadi is desired to know, and Aushadha Kalpana or Aushadhi Namakarana. Okay, Siddhanta, that is desired to know. Okay, so here Aushadhi Namakarana as well as Saviratavadi. These two concepts are desired to know. Again, there may be chances of asking Saviratavadi for 5 marks in the relation with desire to know. Okay, however, we will get total 10 marks desire to and nice to know. Okay. So here Dravya Sangrahana, let us go through this Dravya Sangrahana and Samrakshana. So what to write if it has asked for 5 marks? Okay. The therapeutic efficacy of any drug depends strongly on the methods followed to its collection and storage. Okay, if the raw drug is not a genuine or it is not properly collected or not properly stored, and they if you prepare medicine from such raw material, and it is very difficult to get a therapeutic efficacy. For that reason, good raw material will gives a good therapeutic efficacy. Okay, the point of the significance during drug collections are below, like time of drug collection, place of drug collection, the state of drug collection, and method of drug collection, and storage and preservation. Coming to the time of drug collection. So some general rules they have been explained. So according to the different acharyas, there is a specific time period for the collection of drugs, like Patra and Shaka collected in Varsha and Vasanta roots. If it is a Ushtavirya, then it should be collected in Grishma Rutu. For Shitavirya, Shishira Rutu. In the similar way, bark, tubers and latex, Sharada Rutu. For Sara or Hartud, you have to collect in Hemanta Rutu. And Phala and Pushpa, this is according to the season as per Charakacharya. In the similar way, according to Shushruta, the collection of different parts according to the season. In the similar way, uh, Sharada Rutu is the best time for collection of herbs for all. Uh, for the drugs of woman and Virechana, the best time is Vasanta Rutuhu. Okay. So, as per Sharangadara, he will tell that for the collection of woman and Virechana Dravyas, the Vasanta Rutu is the best one. The time of the day for drug collection, again, it is indicated by many classical texts that Aushadha Dravya is collected in a early morning hours only. Okay. So again, it is said to be perhaps that Brahma Murta Kala, the yield and the potency of drugs are expected to be more. Okay. So again, the Bhumi Mahabhuta predominance and drug collection. Susruta described the significance of soil while collecting the drugs for the different therapeutic procedures, like Prithvi and Jala Mahabhuta Pradhana for the Virechana Dravyas. If you want to collect Virechana Dravyas, there should be like Prithvi and Jala Mahabhuta Pradhana Bhumi. In the similar way, if you want to Vamana Dravyas, then Agni, Akasha and Vayu Pradhana Bhumi. For both above soils together, Ubaya Bhagahara Dravyas. The Akasha Pradhana Bhumi for the Shamana Aushadhi Dravyas. So the place from where the drug should not be collected, like the reference of Sharangdara, he will tell that Valmika, Kushtashita, Anupa, Samshamana, Ushira Pradesha, Margaha, and Jantu Pidita, Agnidagdaha, and Ima Veptaha. So these are the conditions, or these are the areas, or these are the places where the drugs should not be collected, like Antil soil, okay, Vibhasthasthana, or marshy land, okay, or burial ground, or it may be saline soil, or where that roads are their walking lanes, or Jantupid, it is affected with any Kita or worms, and Agnidagda, and if it is affected with Hima, okay, in these places we should not collect it, okay. The similar way, these are some of the stages of drug collections. Dvigunamana, concept of Dvigunamana, and rationality behind Dvigunamana, exception for the rule of Dvigunamana, and this is next the Dravya Sangrahana Vidhi. So next the storage, the Dravya Samrakshana. Any drug or material which is collected should be stored in the suitable conditions to retain their inherent drug properties until the drug goes into the preparation. For this, the most primary thing which we require suitable containers to store the raw drugs. Then they are kept in a storerooms which are built in an airtight area with a plenty of precautions for the sanitizations. Okay, and the storehouse shall be cleaned regularly by ritual methods. Okay, so this is like different parameters they have been explained for different yoga. The similar way, the importance of rasa guna vira vipaka karma etc. have been explained, and mutual relation between rasadi gunas etc. So these are the concept of dravya sangrahana and Dravya Samrakshana. Okay, here again I will go through the syllabus point first. So dravya sangrahana and samrakshana, they may ask for short answer for 5 marks. Again they may ask aushadhi sevana kala and savirata avaradi together or matra. We know that one here two topics are desired to know, that is savirata avaradi and Aushadha Namakarana Siddhanta. Okay, these combinedly they point number next, that is fourth syllabus point number. So again it carries total 5 marks. Okay, again in this we are having one MCQ, one SAQ. Okay, one MCQ and one SAQ. So this is the concept of yantra. These are the previous RGHS papers. Now the pattern has been changed. Vidyadhara yantra, Dola yantra, etc. So yantras for you, all yantras, what are the classical yantras they have been given in a must know. Okay, that describe the principle behind the construction and working of classical yantras used for the Ayurveda Aushadhi Nirmana. So means all the yantras are must know. The modern machinery is like it may be grinder, okay, pulverizer, powder mixture, mechanical sifter, ball miller, granulator, dryer. Okay, these are desire to know concepts. Again, there may be chances of asking desire to know questions. It carries 10 marks. You know that one, 10 marks. Again, I'm repeating 10 marks for desire to know, nice to know. Okay, so if at all the yantra is asked, so you have to write the yantra uh, shloka. If you know the better, you know, write the shloka. I have taken the example of Vidyadhara Yantra. Yantram Vidyadharam Gneyam Stali Ditiyam Samputam Shullim Chaturmukim Krutva Yantra Bandam Niveshaye Tatraushadam Vinikshipta Niruddha Banda Kananam Yantram Vidyadharam Namam Tantragne Parikritam. Here the Vidyadhara Yantra, specifically the reference of Rasa Ratna Samuchya chapter 9. Here he will tell that Chaturmukhi Chulika. Uh, Here specifically he will tell that Chaturmukha Chulika means the heat or Agni is given from four sided. Here the concept of giving Agni from four sided is the Tivra Agni require. For that reason he will tell that the Vidyadhara Yantra Chaturmukhi Chulika. Okay. The construction of Yantra, you have to write the reference sloka if you know, and construction of that Yantra and diagram of that Yantra and where it is used, application of that Yantra or use of that Yantra. Here this Vidyadhara Yantra used to extract the par or mercury from the ingula, mercury from cinnabar or extraction of parada from ingula. Okay, here then earthen pot or vessel taken, parada with other prescribed drug to be kept inside the vessel, and another part is filled with water kept on the lower part. Okay, the joint between these two parts should be sealed properly, and the whole apparatus is subjected to Tivragna. Okay, that is Chaturmukha Chulika. Okay, so this is an brief of Vidyadhara Yantra. In the similar way, you have to go through the individual yantras, how the yantra is constructed. Okay, and after that, uh, what are the application or usage of that individual yantra. Okay, these all classical yantras are must know. Okay, they may ask any one yantra for short answer or 5 marks. Okay, again there may be chances of asking uh, modern equipment for 5 marks also. So moving to the concept, next syllabus point number 5. Again, this will carries for 5 marks. Again, in this also we will have one MCQ and one SAQ. Okay, so this is Puta, like principles involved, importance of temperature, currently using heating devices utility, quantum of heat, and instrument used in large scale production of Puta. They given like examples like Chandra Puta, Surya Puta, Mahaputa, Gaja Puta, Varaha Puta, Kukuta Puta, Kapota Puta, Lava Kaputa, etc. Here, one MCQ is there, one SAQ is there. Okay. Here you will get like number of Vanophila used in Kapota Puta. Okay, are number of Varnophala used in Mahaputa. Okay, so like that you will get MCQ, one MCQ. Okay, or you may get the pit size. Okay, Gajaputa pit size related MCQs. Okay, how much depth of a pit size in a Gajaputa or Kukuta Puta. Okay, so here some along with the concept of Puta, we are having the concept of uh, Musha, Samanya Musha. Here, only one example of Samanya Musha. Crucibles, silica crucibles, mudra, and Sandhi Bandhana concept. Okay, here we are having Kosti, Chulika, Angara Kosti, and Satopatana Brasti, and modern equipments like heating equipment devices like hot plate, gas stove, heating mental, etc. Okay, so again, here we are having a concept define the term putta and recite its classical explanations. And again, the size of a pit, number of vanophalas, use etc. Like Mahaputta, Gajaputta, Varaputta, Kukuta Putta, Kapota Putta, Lava Kaputta, Kumbha Putta, Banda Putta, Valu Kaputta, and Bodhara. All puttas are must know only. Okay. So here, these all classical puttas you should read. Okay. And again, it doesn't mean that those modern equipment will ask in relation to 10 marks only. Okay. So moving to the concept of putta, what to write. Okay. So again, here they may frame the question like define putta and putta prayojana for 5 marks. They may ask define putta and describe Mahaputta for 5 marks. Define putta, describe Gajaputta. Okay, or just they may ask define putta and putta prayojan. So moving to the putta definition, rasati dravya pakanam pramanam jnapanam putam neshto nunadikah pakah supakam itam aushadam. Rasaratna Samuchaya reference. So that which indicate the quantum of heat requires by the rasadi dravyas for their proper paka or insertion is known as puta. Okay, here nesto nunadiko neither less nor more. Okay, that eating which is desirable to get the supaka, that is nothing but sukha. Supaka, that is nothing but the puta. The drug or medicines which are only considered the best medicine, that is itam aushadam. Okay, so because they are pharmacotherapeutically suitable for the internal allergy. If it is kharapaka or murdupaka, there is no use. Okay, the how much it is required to get the paka, that much of it should be given. So Putta Phala Prayojana. Okay. So this is a shloka of Putta Prayojana. Lohada Apunarbhavo Gunadikyam Tato Agrata Anapsu Majjanam Reka Purnata Putato Bhavet Puta Grabno Lagutvam Sigram Kshiptancha Deepanam Jaritadapi Sutendra Loha Namadiko Gunaha. Again, the Rasaratna Samuchaya reference. So here the Basma should pass the Apunarbhava Pariksha. What you have discussed in syllabus point number 2 earlier, Basma Parikshas. So here the Putta Phalaprajan means if you given Putta to the any drug, it should pass the Anupunarbhava Pariksha. Gunadika, it should increase the potency of Basma. And Tato Agrata, that Basma or that drug it should said to be Sreshtavan, and it should float on the surface of the water. Again, Anapsumajanam. That is again Varitara. It should passes Varitara and it should passes Reka Purnata. Okay. It should enter the furrows of the fingers. Okay. Sigravaptihi. It should quickly spreads all over the body. Okay. And it should stimulate the Agni, Deepanaha. Okay. And Jaritadapi Sutendra Loha means having a better potency than the Jarita Pardaha. Okay. This is the benefit of Putaha or Puta Prayojana. Okay. If you get the question like define Puta and Puta Prayojana, you have to write this. Moving to the classification of Puta, the classification of Puta have been classified Agniputa, Suryaputa, Chandraputa. The Agniputa again they divided into Murdu, Madhyama, Lavaka, and Kapota. Madhyama we are having example is Kukuta and Varahaputa. In Tivra we are having Mahaputa and Gajaputa. Okay. So as the medium of it, Surya Puta, Chandra Puta, and Dhanarashi Puta and Agni Puta are there. Okay, again, according to the text, we will get these Mahaputa, Gajaputa, Varahaputa, Kapota Puta, etc. Okay, so here, if you get such questions like Mahaputa, define Puta, describe Mahaputa, if you know the reference shloka, you have to write the reference shloka, then you have to write how you are going to construct a puta, means the size of a pit. Okay, then you have to write the distribution of vanophalas. How many number of vanophalas, and above the samputa how many numbers, and below this samputa how many number of cow dung cakes are vanophalas. Okay, so here it is very important. The size of pit. Okay, length, breadth, height. Here in the Mahaputa, we are having two asta pramana of length, breadth, height. Okay, and the vanophala should be filled with 1,000. And 500 again over the samputa. Below you will fill 1,000 and above 500. Above the samputa 500, below the samputa 1,000. Total 1,500 vanophalas are used. Okay, so where it is used? So here this Mahaputa is used to get the Abrakabhasma, Tamrabhasma and Vajrabhasma. Here Tivartagni is revered, the temperature range is more. For that reason, this Mahaputa is used. Even for Gajaputa, Abrakabhasma also we will use Gajaputa. Okay, so this is in relation with the concept of Puta. Okay, you may get the questions like define Puta, Puta Prayojana, etc. Okay, the MCQ they may ask the number of vanophalas in a different Puta and pit size, and some specific Banda Puta, why the name Banda came, depending upon on the basis of that vessel used, we will get Kumbha Puta, Banda Puta. Again, if Tusha is used, which Puta, if Tusha is used, or Gorvara Churna is used. Like that, they may ask. And moving to the next syllabus point, that is syllabus point number 6. This is a total 10 marks. It will carry one MCQ, one SAQ, one LAQ. Again, they may ask one long essay or long answer. They may ask one short answer, or they may ask one MCQ. Okay. So this is a basic concept Panchavida Kashaya Kalpanas. So these are the RGHS previous question papers. Explain Panchavida Kashaya Kalpana and explain importance of basic principles of Panchavida Kashaya Kalpana. And moving to the syllabus points. Okay. So definitions, classifications with the suitable examples, reference, ingredients, quantity, method of preparation, principle, etc. These are the individual like Swarasa, Kalka, Kwata, Ima, Fata. Each one you should write the definition with ingredient, the method of preparations, which principle involved, what are the instruments used. Okay, so usually you may get a long essay in this one. Okay, the Kwata and Fanta Kalpanas, you may get long essay. For Swarasa and Hima, you may get short essays. Okay, again, all are must know concepts. Here we will go with Swarasa. So introduction, if you asked for a long essay or to give the some introduction basic. Here the Ka means Kaya, Sha means destruction, means here it means which protects body from the destruction of, that is said to be Kashaya. We will have some different authors with different Panchavida Kashaya Kalpana. Like Charaka, we get Swarasa, Kalka, Shruta, Sita, Fanta. In the similar way, Ashtanga Kara, Ashtanga Rudayakara, Sharangadara. Shushruta, he will have different nomenclature in relation with this Kashaya Kalpanas. He'll tell that Kshira, Swarasa, Kalka, Shita, Fanta, Churna. In the similar way, Kashyapa will have different nomenclatures like Swarasa, Kalka, Kwata, Shita, Fanta, Churna, Abhishavahan. Okay. So moving to the importance of Panchavida Kashaya Kalpana, you have to write. So the used for making available drug more palatable. Okay, and again, according to the strength of a patient and condition of a disease, we can utilize different formulations or different these kashaya kalpanas, because we know that one when compared to the swarasa and fanta. Okay, fanta is lighter than hima is lighter or lagu than kwata. Kwata is lagu than kalka, and kalka is lagu or lighter than the swarasa kalpa. Okay, so you have to write this one. Lagutta krama of Panchavida Kashaya Kalpana. Atataha Swarasaha Kalka Kwatas Chaima Pantakav. Gneya Kashaya Panchate Lagava Shud Uttaruttara. Okay, here Uttaruttara Lagu means Swarasa is heavier than Kalka, Kalka is heavier than Kwata, Kwata is heavier than Yama. Okay, and Pancha Kashaya Yoni already this is discussed or this is you have studied in syllabus point number 2. Okay, except Lavana, all 5 rasas are Kashaya Yonis. Okay, then you have to write the definition of that one, like definition of Swara, Yantra Nishpidita Dravyat Rasaha Swarasa Uchate. Better you should buy it or we should go through the Sharangadara's shlokas. Okay. So next you should write this method of preparations individual. Here we are having different like Nishpidita Swarasa, Nishoshita Swarasa, we are having Agnisiddha Swarasa and Putapaka Swarasa. Okay. So next Prakshepaka Dravyas, you have to write the dose. Here dose is Agnisiddha, it is half pala. Okay. Anagnisida is half pala and Agnisida is 1 pala. Self-lies in these all Panchavida Kashaya Kalpanas are instant use. Okay. And advantages of Swarasa, readily used as Anupana, used as a Bhavana Dravyas. Okay. Used as a Shodhana and Marana of Swarasa Dravyas, and used in the preparation of secondary preparations. Okay. So this is in relation with the Swarasa Kalpana. Okay. So similar way, you have to go through individual like Kalka, Kwata, Hima, Fant. Okay. So here there may be chances of asking long essay. Okay. They may ask enumerate Panchavida Kashaya Kalpana or name the Panchavida Kashaya Kalpana and explain or describe the Kwata Kalpana or describe the Swarasa Kalpana. Like that they may ask. Here Anupana and dose you may get MCQ. Okay, what is the dose of Anagnisiddha Swarasa? Okay, that is Apala. Okay, dose and Anupana, there may be chances of asking MCQs. Okay, so you go through all those things. And similar way, the Upakalpanas here they have been explained. Kalka Upakalpana Churna Kalpana, Kwata Upakalpanas like Paniya, Ushnodaka, Kshira, Laksharasa, Mamsarasa, etc. Okay. Sima Kalpana, Manta, Udaka, Panaka. Again, you may get MCQs like Paniya Kalpana is Upakalpana of. They may give options like Kalka, Kwata, Ima, Fanta. Okay. The Paniya is a Upakalpana of Kwata Kalpana. Okay. So you may get such MCQs. So moving to the next point, that is syllabus point number 7. Okay. So again, this syllabus point number 7 carries 10 marks. So here we are having Avaleha, Sneha. In this again, syllabus point number 7, 10 marks, 1 MCQ, 1 SAQ, 1 LAQ. Okay. Here there may be chances of asking long essay also. Okay. So here in this we are having Avaleha Kalpana, Sneha Kalpana, Sandana Kalpana, and Patya Kalpana. Okay. So here I will take an example of here all the must know, like it may be Avalya, Sneha, Sandana, or Patya. All the concept are must know only. No is the concept of Avalya Kalpana. So if he asked for, if it is asked for 10 marks, You have to brief the introduction of this Avaleha Kalpana, definition of Avaleha Kalpana, general method of preparation, then Siddhi Lakshanas, Avaleha Siddhi Lakshanas, Pakakalina Pakanantara, importance of temperature. Usually Sneha Kalpanas and Avaleha Kalpanas. So in Vaishali Kalpana, any procedures in the new syllabus, they are given that importance of temperature. If you given the Mrudu Agni, there may be chances of Mrudu Paka, you won't get proper Paka. Madhyama Agni, you'll get proper Paka. Madhyama Agni is advised. Okay. Except like Kupi, there is they will start with Mrudu, Madhyama and Tikshna Agni. So almost all procedure Mrudu and Madhyama Agni only. Okay. So here the importance of Agni or important temperature means how much temperature should be given, whether it is a Mrudu Agni or Madhyama Agni or Tikshna Agni. Okay. Next, you have to write the dose, Anupana, and indication. Indication, if it is example like Vasa Haleha or Chavanprasha Haleha, where it is indicated, you have to write an example where it is indicated. Okay. So, Avaleha Kalpana, this is a general method of preparation. Kashaya, Swaras or any other liquid preparation is prepared. Okay. Like sweetening agents like Guda, Sharkara or Kanda Sharkara are dissolved in that liquid over Mandagi, mild fire. Then blend may be filtered and to get rid of physical impurities. Okay. So if any like sand particles are there, to remove all those impurities, we have to go filter that one. The filtrate is again a reboil to reduce or to get the 1 to 2 thread consistency. Later that ghee is added just before the Paka Lakshana stage. Once the Avaleya Siddha Lakshanas are attained, the Prakshepaka Dravyas are added and properly stirred. Okay. And wherever the honey is there in Avaleha Kalpanas or any Kalpanas, the honey should be added at the end after the Swangasita. When the all the preparation or at the end of the preparation, when it become cool, that time you should add the honey or madhu. Okay. So in the similar way, you go through the Sneha Kalpana, Sandala Kalpana, and Patya Kalpana. In relation with this Patya Kalpana, here the proportion are very important. 1:6, like one part of drug, 6 part of water, one part of drug, 10 parts of water. Like that, here proportions are very important. On the base of proportions, there may be chances of getting MCQs also. Okay. So this is the concept of Avaleha. Moving to the next syllabus, that is syllabus point number 8. Again, it carries 10 marks. Okay. So here I will not go in detail of these individual drugs. There are many drugs in relation with this syllabus point number 8. And again, this syllabus point number 8, all drugs are must know drugs. Uh, Here you are having one MCQ, one SAQ, and one LAQ. There may be chances of asking long essay or short essay and even MCQ also. Okay. So these are some previous RGHS question papers. Okay. So define dhatu, write the classification, Grahya Lakshanas, Shodhana, Marana, therapeutic uses, and formulation of Sarana dhatu. Classify Rasadravyas, explain in detail about Makshika in context to its synonyms, types, Grahya Lakshana, Shodhana, Marana, Matra, Upayoga, and two yogas. Okay. Explain Dhanya Braka with its aim and write its mark. Okay. So here we are having some drugs which is maybe Maharasa group or Uparasa or Sadharanasa. They are combined or they are given Rasa Dravya Parichaya 1. These are our must know drugs. Okay. So here you should go through the Shodhana Marana shlokas. Better to memorize Shodhana Marana shloka. If you are well and good, if you want to, you can again you can buy it like Graha Lakshana is there, again synonyms. At least you should know Shodhana and Marana shlokas. Okay. These Parada, Abraka, Makshika, Shilajato, Gandhaka, etc. Okay. So a similar way, syllabus point number carries 5 marks. Here they may ask one SQ, one MCQ. Okay. So in this We are having Sasyaka, Kasisa, Gauri Pashana, Trikantaka, Akika, Sudha, Katika, Ajasti, Jahormo, and Dugda Pasha. Okay, here Shodhana and Marana concept are must know. Okay, syllabus point number 9 and 10. Okay, Shodhana and Marana concept are must know, and remaining like it may be synonyms, source, types, graya. Okay, yogas. These are desired to know. Okay, and for each syllabus point number 8, 9, 10, they given research updates. Okay, so any research work related or pertaining to that drug you have to write. Okay, any article. It is not like that everyone should write the same article. It's not like that. If you know any research work in relation with that particular drug, you have to write any one or two research updates. It's well and good. Okay, so moving to the sasyaka, uh, like your example taken sasyaka, you have to write the occurrence where it is. We will get like native of Germany, Spain, Sweden, France, England, and in India. In especially in India, we'll get Bihar, Rajasthan. Sources: natural sources, Picacore, Bronite, etc., and artificial sources, Copper sulfite. Synonyms are Pariyayas, Tutta, Tuttaka, Mayuraka, Sasyaka, Tamragarbha, Shikigriva. Okay, so these are the some Pariyayas. Usually, Pariyayas, types, and those you may get the MCQ in relation with these syllabus point number 8, 9, 10. Okay, so after that pariyas types according to Acharya Chakrapani, two types, Mayura Tutta and Karpara Tutta, according to Rasa Jalanidhi, Sobhavaja and Krutivijan. Natural occurring is Satyaka and artificially prepared is Tutta. Okay, so coming to the Grahya Lakshanas. Okay, so good quality of Tutta should possess following character, that is Sikhi Kanta Samuchaya, having the complexion of peacock neck. It is Guru, heavy in nature, Snigdha, smooth and soft, Mahojwalam, bright and shiny. Shodhara Tutta. Okay. Sasyaka gets purified by doing bhavana with Raktavargiya Dravyas. Okay. Whenever you will get for syllabus point number 8 and 9 and 10. Okay. Shodhana, concept of Marana. Try to write the shloka if you know, and write the procedure in a flow chart. It will be easy to evaluate, to easily they can evaluate. Okay. Like Ashodita Tukka is taken in Kalvayantra, made into fine powder. Bhavana Dravya is added, that is Rakta Dravya. Rakta Dravya, that is Mandishta Kwata. Trituration is done till Bhavana Siddhi Lakshana appear. After that, allowed for drying, and later it is taken out from the Kalva Yantra and stored in an airtight container. This is the procedure of Shodhana of Tutta. Similar way, Marana of Tutta. Again, you have to write the flow chart. Here, we will take Shodhita Tutta, Shodhita Gandhaka, Shodhita Tankana in a Kalva Yantra. Bhavana Dravya is added, that is Lakucha Swarasa. Trituration is done. After getting consistency, we have to prepare the chakrikas. The prepared chakras we are going to keep in Sharava, and Sharava Samputa is prepared, and that is subjected to Kukuta Puta. Here, to get a Sasyaka Basma, we require 3 Kukuta Putas. Means the whole procedure is repeated for the 3 times. Next, you have to write the qualities of Basma, that is nothing but indications. It is a Lekana, Bedi, okay, Krimigna, Chakshusha, Meha, Medohara. It is indicated in Prameha, Kapha Pittahara, etc. conditions. Okay, next dose. Here, the dose of Tutta can be administered to 114 Rati, that is 15 to 30 mg. Okay, 1/4 of Rati, that is 15 to 30 mg. Anupanas like Madhu, Tambula Patra Sarasa, Vidanga, Grita, etc. Okay, so again, next management of Ashuddha Apakva and Aviti Sevanajaniya Dosha. If at all any ill effects caused by Ashuddha Apakva Avidhi Sevana Janetutta that can be relieved by administration of Jambira Rasa or Laja Manda for 3 days. Okay. Patya, Apatya, Patyashali, Goduma, and Mugdha Grita. During the while taking Sasyaka Basma, you have to follow this Patya. Okay. And important formulations like Garudanjana, Jatyadikrita, Tuttadrava, etc. This is an individual one drug. In the similar way, you should go through the each Sasyaka, Kasisa, Gauri Pashana, Trikantaka, Akika, Sudha, Katika, etc. Here, the Pariyayas, okay, types, then Anupanas, dose, etc. You may get MCQs. Okay. So this syllabus point number carries 5 marks. You may get one question of short answer that may be Shodhana and Marana. Because in this point, Shodhana Marana must know remaining are desired to know. Similar way, the syllabus point number 8 drugs you have to go through like individual drug occurrence, sources, synonyms, types, Grahya Lakshana, Shodhana, Marana, then Basma properties, dose, Anupana, management of Ashuddha, Dapakva, Avidhi, Shivanajana doshas, and Patya with formulations. Okay. Similar way, syllabus point number 10 again, Shodhana, Marana must know, remaining are desired and nice to know. Okay. And moving to the syllabus point number 11. Okay. So this is again syllabus point number 11 carries 10 marks. They may ask one long essay, one short essay, and one MCQ. Here I am going to explain this Gudappa. So before that, here we are having Kshara Kalpana and Lepa Kalpana must know. Okay. Kshara Kalpana, Lepa Kalpana must know. Sharkara, Gudapaka, Lavana, Ayaskruti. These are nice to know. Okay. So why I am highlighting this concept of must know, desire to know, or because must know you will get total 90 marks. Desire to know, nice to know, will get 10 marks. Okay. So this is the general method of preparation of Kalpana. Coming to the Gudappa, if it all asked for 5 marks, you have to briefly you have to write these points. This, if it asks for long answer, again you have to write the Gudapaka introduction. Why it is called Gudapaka? Because the Guda is the main ingredient. So for that reason, it is said to be Gudapaka. Method of preparation. Any examples are there? That time you have to write the ingredients, Siddhi Lakshanas, general precautions. Okay. So before going to the main Pradhana Karma, all the remaining drugs should be powdered or it should be vessel should be cleaned. Like general precaution you have to write. Next, Matra, Anupana, self-life and indication. So these are the points you have to write in individual. It may be Kshara Kalpana, it may be any other Kalpana. Okay. So Guda Kalpana, this is a general method of preparation of Guda Kalpana. Lehavat Sadhate Vandho Gudova Sharkaratava. So any dravya is taken, like it may be Swarasa, Kwata. These are the pre-preparation to Guda Kalpanas. Okay. So to that you are going to add Guda, which is specified ratio and dissolved in a Murdu Agni. Okay. Agni should be Murdu. So it is filtered to remove again physical impurities, filtrate it again, boil to obtain 2 to 3 thread consistency. Later it is taken out of Agni and Prakshepaka Dravyas are added to get a homogeneous mixture. Again, wherever that honey is said, earlier we discussed it in Avaliha only. Okay. If honey or madhu is explained, you have to add at the end. Okay. So after the Swanga Sita, you have to add the honey. Okay. So these are the Lakshanas. Paka Kalina and Pakantra Kalina Lakshanas. Okay. So this is general method of preparation of Kshara Kalpana. So I will not go in detail regarding these. Okay. So there is a chances of getting long essay. I have earlier told, yeah, you should concentrate Kshara Kalpana and Lepa Kalpana. Okay. For 10 marks. Okay. Describe the Kshara Kalpana. They may ask for 10 marks, or describe the Lepa Kalpana, they may ask for 10 marks. Again, the remaining topics they may ask for short essays, because these are desired to know concepts. Okay, so must know concepts of these 2 points. They may ask long essay in these two only: Shara, Kalpana, and Lepa Kalpana. Okay, so this is in relation with syllabus point number 11. Next, moving to the syllabus point number 12. Okay, so again it carries 10 marks. You may get one long essay here. Okay, so this syllabus point Chaturvidya Rasayana. Okay, Chaturvidya Rasayana. Introduction, definition, importance, type, procedure, necessary equipment, shelf life with following example. Like they may ask uh, describe Rasayana with an example of Swasakuta Rasa. Describe the Parpati Rasayana with the example of Sudha Parpati. Describe Rasayana, Kupipakwa Rasayana with the example of Rasa Sindura, etc. Okay. So these among the Chaturvida Rasayanas, the all are must know concept only. Okay. So method of preparation of Chaturvida Rasayanas. So you know that one. Urdu. So individual procedures. It may be thoroughly.
content right from there, poster designing सभी मेरा रात में ऐसा है अतरजी में पोस्टर डिजाइनिंग सब अतरजी को बोल के తర్వాత మా अतरजी थोड़ी विभिन्न डिजाइन
I'm not getting. Anybody having doubts in relation with previous points?
No, sir, you can continue, sir.
Okay. So in relation with syllabus point number 12, Chaturvidya Rasayana, they may ask long essay here with an example. Earlier I told that they may ask describe the Karaliya Rasayana with an example of Swasakutara Rasa, or describe the Parpati Kalpana with example of Rasa Parpati, like that. Okay. So here for individual Kalpana, you have to write the Purva Karma, Pradhana Karma, and Pachat Karma. Okay. Example, if you are writing a Parpati Kalpana, if question is describe Parpati Kalpana with Rasa Parpati, then Purva Karma, what are the requirement for the Purva Karma? It may be the instruments. Okay. It may be vessels, spoon, etc. or banana leaves, ghee, collecting of cow dungs. Okay. And Khajali preparations. Okay. Your raw materials required for those. Okay. Drugs. These will come under Purva Karma. Pradhana Karma. When you take this Kajali in a spoon, heating, those will come Pradhana Karma. In Pradhana Karma only, we'll get Lakshana. Okay. Then Pachat Karma. After that, at the end of the procedure, what you are going to assess. Okay. So here, Purva Karma, Pradhana Karma, Pachat Karma, you have to divide individual. It may be Parpati, Kupi, or Potali. Okay. So this is a general method of preparation. Here I have not taken any example. This is a general method of preparation of Karaliya Rasayana, Parpati Kalpanas, and Potali Kalpana, and Kupipakwa Rasayana. Okay. So this is in relation with syllabus point number 12. Okay. So you have to concentrate. You will get one long essay from syllabus point number 12 with an example, or they may ask general method of preparation. Okay. So moving to the syllabus point number 13. So this is a new topic, the current and emerging trend in Ayurvedic pharmaceuticals. Okay. So here they give cosmetics, formulation, regulatory provisions in relation with cosmetics. Okay. So here the all the concept, these are desired to know and nice to know, means they may ask 5 marks one question from this concept. Okay. So current test I will go or will glance regarding trend in Ayurvedic pharmaceuticals. Okay. So introduction to cosmetics. Any material which is used for the beautification or improvement of appearance is known as cosmetics. The word cosmetics is derived from a Greek word cosmetikos, which means adorn. Usage external, can be used long or short period to beautify the body and keep it healthy. Deals with application of beauty treatments. Okay. So coming to the according to the D and C, this is very important of cosmetic according to D and C Act. Any article intended to be rubbed, poured, sprinkled, or sprayed on, or introduced into, or otherwise applied to human body, or any part of there for cleansing, beautifying, promoting attractiveness, or altering the appearance, and includes any article intended for the use of component cosmetics. Okay, these are all said to be cosmetics only. Okay, so these are the some regulatory provisions. Schedule M2. Schedule M2 classifies cosmetic into 11 broad product categories. Okay, which are said to be in cosmetics. Powders. First, second one is creams, lotion, emulsions, uh, cleansing milk, shampoos. Third one is nail polishes and nail lacquers and lipsticks, lip gloss. Okay, so these 11 will be grouped under cosmetics. And some factory required as per that GMP Act. These are the factory requirement for the cosmetic preparations. And characteristic of cosmetic ingredients, how it should be a broadness, means any substance that which has cleansing or protective or nourishing or therapeutic beautifying effect on the human skin or hair, nails, or any external organs can be selected. Okay, it should have broadness. Effectiveness, the selection of a cosmetic ingredient should be plays a truly effective role in the cosmetics. In the similar way, specificity, capability, specialty of raw materials, etc. Okay. So some most commonly used raw materials like natural oils and fat, waxes, hydrocarbons, fatty acids, fatty alcohols, synthetic glyceride, and fatty acid esters, etc. Okay. So these are some points. You may get 5 marks question in relation with this topic, that is cosmetology. And in this topic only, we are having one more topic, that is dosage forms. Okay. So what is dosage forms of a drug? The definition of dosage forms are the means by which a drug molecule or active principles are delivered to sites of actions within the body to produce optimum desired effect and minimum adverse effect. Okay, this is the definition of a dosage form. Classification of dosage form. You may define dosage form and classify the dosage form. You may get the such question for 5 marks. That time you have to classify based on the routes of drug administration. It is classified into oral, parenteral, topical, transdermal, respiratory inhalation, ophthalmic, rectal, or vaginal. Classification based on physical form like solid dosage form, liquid dosage form, and semi-solid dosage form. Solid dosage form again classified into tablets, capsules, powder, granules. Liquid dosage forms, monophasic liquid doses and biphasic liquid doses. Monoclonic in monophasic liquid dosages we are having mixture, syrup, etc. In biphasic liquid doses we are having suspension and emulsions. Semi-solid dosage forms like cream, paste, ointment, gel, jellies, etc. Okay, this is in relation with syllabus point number 13. So in this you may get one question for 5 marks. Okay, they may ask current emerging trends in Ayurvedic pharmaceutics alone. Okay, or they may ask define dosage forms and classify the dosage forms. Okay, that time you have to classify the dosage form. Okay, yeah, that on the basis of routes of drug administration, on the basis of physical form. Okay, so moving to the last point, that is syllabus point number 14. This carries again 5 marks. Okay, so here we are having a D and C Act, Drug and Cosmetic Act 1940 rules, new acts related to drugs and devices, GMP, GMP, uh, Schedule T. Okay, GMP as per Schedule T, you have to write. So you may ask, you may get such question like describe D and C Act for 5 marks, or write GMP as per Schedule T. You may get such questions. Okay, moving to the D and C Act. Okay, so if it is asked for 5 marks, you have to write D and C Act definitions, then introduction, objectives. So DNC Act totally having concerned with 5 chapters. First chapter deals with introductions and definitions. Second chapter DTAB, DCC and CDL. Third chapter import of drugs and cosmetics. Fourth chapter manufacture of say distribution of drugs and cosmetics. 4A deals with provisions relating to Ayurveda, Siddha and Unani drugs. And fifth chapter is miscellaneous one. Okay. Coming to the schedule T as per GMP. Okay. This is again, they may ask syllabus point number 1 also. Rasashala as per GMP or schedule T. Okay. So good manufacturing practices for Ayurvedic, Siddha and Unani formulations. Okay, these are the criteria should be followed for schedule uh, T as per schedule T. Okay, so GMP are prescribed as to ensure raw material used in the manufacture of drugs are authentic, of prescribed quality and are free from contamination. Second one, the manufacturing process is as been prescribed to maintain standard. Third point, adequate quality control measures are adopted. Fourth point, the manufactured drug which is released for sale is of acceptable quality. And fifth point, to achieve the objective listed above, each license shall evolve methodologically and procedure for following prescribed processes of manufacturing drugs, which should be documented as a manual and kept for reference for the inspection. Okay, this is for pharmacy one. However, under the IMCC Act, practitioners of Siddha, Ayurveda Hakims who have prepared their own medications are for their own patients. They can dispense to their own patients and not selling those drugs outside or in a market. They are exempted from GMP rule. Okay, if at all you are giving the medications to your own patient and you are not marketing your product, that time this rules may not apply. Okay, and they are prescribed as a factory premises how it should be as per the GMP Act. Okay, so these are the points in relation with the syllabus point number 14. Okay, so by this we will end this paper 1 orientation program. Here it's very difficult to complete or glance all the topics. Here I have tried to explain which are the must know topics and which are the desired to know, nice to know, where you will get long essay, where you will get short essay, and if at all, if it is asked for 5 marks, what should be written, and if it is asked for short essay, what are the points should be written. Okay, I have tried. It is a little bit hurry and many topics have been missed because it is very difficult to conclude all the topics within 1.5 or 1 hour. Okay, so at the end, so I may suggest you go yourself enough time to study. Use flow charts and diagrams like any procedures, like it may be sneha preparation, it may be a holiday preparation, or it may be any chaturvida rasayanas, potali kupi, etc. Try to write the flow charts. It will be very easy to evaluator to understand the concept. Try to use the diagram wherever necessity, like yantra puta concept, draw a diagram. Practice an old exam QP. Again, it is not applies to you because the syllabus has been changed. You practice according to blueprint. Okay, go through the blueprint and practice according to the blueprint. And at the end, plan the day of your exam. If you have any doubts or any clarification in relation with this Paper 1, you can ask. Now is open for all. You can ask any doubts or clarification in relation with this point. Or else we will end the session.
We will, maybe if there are any questions, to sir.
Okay. Okay, I wish you all the best for your examination. Go through the syllabus, the blueprint, and read well. I wish you best for your exams. Thank you. I thank you, this Jignasa Karnataka team and Kiran Triloka who have consulted me. And I thank all those team leaders of Jignasa Karnataka giving me opportunity to share this paper 1 of RSBK. Thank you. Thank you, one and all.
Thank you, sir. We have a small request, you sir. We need to introduce you again to the participants and viewers. Kindly request you to on your video, sir.
Okay, 1 minute.
Okay, sir. Over to Vinayak.
Visible? No.
Yes, sir. Namaste, everyone. I am Vinayak Govind from Muniyal Ayurveda College, Manipal. Jignasa is a pan-India initiative exclusively dedicated for Ayush students and Ayush education system, with the aim of safeguarding the health and understanding the medical methods and theory that come under Ayush. Jignasa implements various student-oriented and society beneficial activities. Today, Ayush is gaining prominent portion in the global health system. So then it is need to empower our education system towards the global challenge. For this, Jignasa is trying to bring together the medical students, teacher, doctor, and administrative of our system together in order to bring the desired changes. Sir, your video is not audible, sir.
Videos.
Not visible. Okay, sir. It is visible. Jignasa
Now
with its
visible?
motto. Yes, sir. It is visible. Jignasa with its motto, Learn Ayush to Practice Ayush, has started unique program Yashasvi Baba, Prepare, Perform, Prosper, an exam-oriented series tailored to help and guide second-year BMS students, mastering them in every subject with the support of expert professors. It's my privilege to introduce our guest speaker, Dr. Shivasharanappa sir. Dr. Shivasharanappa sir graduated from Sri Jagadguru Gavisiddheshwara Ayurvedic Medical College and Hospital, Koppal, Karnataka in the year 2012. He completed his postgraduate studies in the Department of Rasashastra and Bhaishajya Kalpana from Tarnath Government Ayurveda Medical College and Hospital, Ballari, Karnataka in 2016. He has been a teacher for 7.5 years in Rasashastra and Bhaishajya Kalpana. Sir is known for his creative teaching and learning methods. Dr. Shivasharanappa sir is presently working as an assistant professor in the Department of Rasashastra and Bhaishajya Kalpana at Government Ayurveda Medical College and Hospital, Bengaluru, Karnataka. I'll welcome you. Eric,
Thank you, sir. Thank you from whole Jignasa team for your wonderful informative session, sir. We hope further we will do many more sessions with you, sir.
Thank you. Thank you, Team Jignasa. Thank you, Anandar. By this, we will end session. Thank you.
we now come to end of the session. By the blessings of Almighty, the session becomes successful. Thank you, sir, for your informative session. Your words helped and guided many students We hope you will be with us in our future Jignasa programs. Behalf of my whole
Definitely.
Jignasa team, I extend my heartful gratitude to Dr. Shivasharanappa sir for presenting this session despite of their busy time. Thank you to all participants who joined and viewed this session. Thanks to Jignasa and everyone. Thank you, sir.
Thank you. Thank you.
Tejas, you can end the live.